Thanks for joining us on Facebook Live and through Zoom for our discussion, COVID-19 vaccine hesitancy, setting the record straight. I'm Hartford Healthcare's Brian Spyros. Tonight, we are going to have a very important discussion surrounding the COVID-19 vaccines. There are currently 3 of them being administered: Pfizer, Moderna, and as of last week, Johnson & Johnson. We know COVID-19 has impacted everyone across the board in every community. But tonight, we're specifically talking about the impact the virus has had on the Black and Hispanic communities and really dive into the reasons why to help put everything into perspective. We're also going to answer why people in these communities are apprehensive about getting vaccinated, answer questions about the vaccines, and help you make an informed decision about getting vaccinated. There's also some new guidance that just came down from the CDC regarding people who are vaccinated and gathering. So we'll get to all of that, a lot to get to this evening. Joining me now to talk all about this is Dr. Henry Anyimadu, an infectious disease specialist at the Hospital of Central Connecticut in New Britain, and Mr. Ronald Davis, president of the New Britain chapter of the NAACP. Gentlemen, I want to thank you both for being with us here tonight. A lot to get to, as I mentioned. Dr. Anyimadu, we're going to begin with you. We have heard over the last year that the Black and Hispanic communities have been disproportionately impacted by the COVID-19 virus. And again, we want to put all of this into context for people who are aware of this or who may not be aware, but why have these communities been impacted the way they have over the past year?
You know, it's very true that people of minority groups, Blacks and Hispanics, have unfortunately been very disproportionately impacted by COVID-19. But, you know, COVID-19 has just illuminated the long-standing systemic health and social inequities. Normally, the way I like to put it is that first, why are people or why are Blacks and Hispanics getting infected? And then 2, why are they the ones that are dying more from COVID-19? You know, people in the Black and Hispanic communities are unfortunately disproportionately represented in the essential workforce. They work in healthcare, farms, in factories, grocery stores, public transportations, and they can't work from home. And then when they come back home, some of these people live in crowded conditions. They live in multi-generational homes, children living with parents, grandparents, all living together. All of this will increase their exposure. And then the other question is, why are they more likely to die? So if you look at all the diseases that put people at risk of severe COVID-19 disease and death from COVID, which includes obesity, diabetes, heart disease, kidney disease, sickle cell diseases, all of these diseases are more prevalent in the Black community, in the Hispanic community, and unfortunately in minority groups. And then you throw on access to healthcare, the mistrust that people of color have for the health system, the discrimination that they face, educational and wealth gap. All of these factors work together to make people of color more likely to be infected by the virus, to be hospitalized by the virus, and to die from COVID-19.
And obviously very eye-opening when you put it all into that perspective. Mr. Davis, as the leader of the local NAACP, what have you heard from the community over the last year in terms of the impact that the virus has had on people and their concerns surrounding it?
Well, I've heard quite a bit, as you could expect, because from the beginning of the virus, when it first came out and the information came out to our communities, we didn't know what to do. We didn't know what the virus was. We didn't know where to go for help. We just knew people in our community was dying in large numbers. Many people in the churches, a lot of us go to church. When we have the gatherings at the churches, many of the leaders in our churches were dying from the COVID-19. Funerals, you go to a funeral, many people died from these funerals. So as things continue to progress, and the virus was spreading even more, the fear, there was so much fear in our community on what do you do? Who's going to help us? It came to the point we have to help ourselves. So therefore, we had to get information. We had to get information from people that were connected with the community, doctors that we knew, listening to them, and just tell us about this virus. What is it? How do we protect ourselves? But that's just one segment of the community. Everybody doesn't go to churches. There's a number of people that didn't believe any of the things that folks were telling us about the virus. They thought it was an attack against the Black community. They thought there was some hidden agendas that, that we were going to be alien, it was killed off, and so we had to work on that. So we looked at the education. It affected our kids going to school. It affected our jobs. People started losing jobs because they could not stay home. They could not go to work and leave the kids at home because you would have DCF against you. So they had all these concerns that they had to deal with. They lost jobs. People didn't have money for food, for clothing, for heat. There was a lot of different disparities within the community that people were just not surviving. And so the economy, our Black economy was going down. The kids were being educated at home, some going to school. It was just a mess. It was just from one end of the spectrum to the other one, and confusion. Then we started hearing myths and myths and lies and false things about the virus and what to do about it. So the NAACP, our job was not to tell a person to take the vaccination at all. Our job is to educate them. And that's what we've been doing, trying to educate the community with the doctors and the scientists, not with the butchers, not with the teachers, not with the ministers, but with those two fields, scientists and the doctors who had the information and can guide us right with the right information so that our people can make the right informed decision to take the virus or not to take the virus. I took the virus. I took the virus and with a prayer, because we pray over everything. We pray before we eat. We pray before we go for a job. We pray before we go to get a new house and ask the Lord for his blessing. And so pray over, if you're not sure, pray over the virus. Lord, protect me. And you go from there, because the vaccination right now that I know of is the only thing that could save us from the virus besides the Lord himself. And there's three vaccinations, and they say either one of them is just as good as the next.
And Mr. Davis, I'm glad you clarified there the role of the NAACP is to really just inform people. And we were talking about this before we went on a little while ago, but you've received your first dose, and I believe next week or the week after, you're going to be getting your second one.
March the 17th, I'll be getting my second dose, and I'm waiting for it with anticipation. Yes.
All right. Yeah. You and many others.
The other people in my community, I hope the other people in my community would also do, and all communities would do the same thing, and trust the scientists, trust the doctors, and do what you have to protect yourself and save yourself. People are dying.
Dr. Anyimadu, I want to come back to you. So this question's two parts. Fast forward through the year that we've just been through now, as I have mentioned at the top of this interview, that, we have these 3 vaccines now. But what is the data showing in terms of the breakdown of people who have been vaccinated so far?
As of last Friday, there were about 10% of Blacks that had been vaccinated, about 8% of Hispanics, and 22% of whites. So the proportion of whites who have received at least one dose of the vaccine is more than twice that of Blacks. And it's similar with Hispanics as well. We're seeing that minority groups are not accepting the vaccine or getting the vaccine as they should. There are several reasons why this is happening. The whole web-based or phone-based scheduling for the vaccine has been very challenging for minority groups. And then there's also vaccine hesitancy too. There's a lot of people that are hesitant to get a vaccine, but I think it's more about access to the vaccine, to the vaccination centers. That has become a major problem because people are beginning to come on board and to decide to get a vaccine. But unfortunately, some of these people don't have access. They don't have access to the internet to even make these schedules to go get the vaccine. That's why Hartford Healthcare is opening all these mega vaccine centers in downtowns, and also deploying mobile vaccination units to help. But as I always say, that it breaks my heart to think of the fact that people that are more likely to die from COVID-19 are less likely to get a vaccine. We all need to do more to support minority groups.
And for you too, Dr. Anyimadu, and you just kind of alluded to this, but I mean, you've seen the devastation that this virus has caused. And so when you hear that Black or Hispanic people are getting the vaccine at half the rate as others or of white people, I mean, what is that? How does that make you feel when you've seen what's happened to the virus and then you see the numbers?
It's sad, because there was a Pew Research study that came out that said that about 71% of Blacks have seen someone who has either been hospitalized or died from COVID-19, but only 41% of Blacks decided that they were going to actually get the vaccine, which is very unfortunate because we've seen people die from COVID-19, young people, elderly people, and it's sad when someone walks into the hospital or comes to the hospital and you can tell that it's not going to go right, or this person is probably not going to do well. It's very sad. And we are seeing deaths more in the minority groups, in Hispanics and in Blacks, right? So I think everyone out there need to make the effort, especially our minority groups. People need to make the effort to get a vaccine.
Well put there. Mr. Davis, we just kind of spoke about some of this, but it's important to really put into context why the vaccination rates among these communities, the Black and Hispanic communities, are low. There have been two big barriers: information and accessibility. Can you speak to both of these and how they've really contributed to these low numbers of people in these communities getting vaccinated?
Well, first the information piece, that communication piece. If it's not communicated to you or to people that can share the information with you of where you can get the vaccination, how do you go about registering and so on and so forth, you can't do it. You look for it. And so we depend on our doctors, our regular doctors. We say, well, when we go to the doctor, we'll have our doctor give us a script, whatever, so that we can get the vaccination. That's the wrong thing to do. We learned that. So information, it was not really given to the community. To the ministers, information was not given to them so they could share with their congregations. So and I think that's a big piece of it. Then when the information came, it came in so many different ways, very confusing. Some said this and some said that, so you're confused. So therefore, you're not motivated to get up and try to figure out this communication and get your shot. Then Hartford Healthcare, they came with that bright idea of having this mega center in the center of town, New Britain. I was so excited. I was excited because now, first of all, I'm pretty good with a computer, and I could not navigate on the computer of getting a vaccine. I'm pretty good with a computer. So since Hartford Healthcare came with the mega center, I was able to use my health chart. Everyone can't use that either. And I was able to established a appointment. I was able to do it right quick. I was so excited about it. I ran out of the house. I told everyone, I got an appointment. I got an appointment. This is what you do. But guess what? When they went to do it, it was all booked within 2 days, all booked. And so some folks I know this weekend had to go all the way to Bridgeport to get a shot, because although we have the CVS, they're booked. And they're booked. A lot of these places are booked with people out of the community. They have, it's their right to come and get shots also. But the people within the communities don't have access to the computers like a lot of other people have. They don't have transportation like a lot of other people do. But to have a site downtown New Britain where public transportation can drop them off downtown New Britain and they can get to the One Liberty Square easily from there is I believe it's going to help out. But when I went, it was sad. Wait a minute. When I went, it was sad because I still don't see Black folks in line getting vaccines. When I go to the pharmacy to get my medicine, I see the stations for the vaccines, but I still don't see Black folks. So I know I have more of a responsibility to get that message out. Get your vaccination. This is where you do it, and contact other people within the community to say we need help.
And hopefully having conversations like this one will help. This is not an easy conversation, but it's an important one.
Yes.
And I just want to spend a moment talking about that accessibility, because Hartford Healthcare has put a tremendous amount of work into making sure that communities across Connecticut have access to this. So we've been mentioning these mega vaccine clinics that we opened. So far, we've opened these clinics at Foxwoods, the Oakdale Theater in Wallingford, which was just last week, One Liberty Square in New Britain, which Mr. Davis just mentioned, Central High School in Bridgeport, and the Xfinity Theater in Hartford. Sacred Heart University in Fairfield will be coming soon. Last week, we had vaccine clinics at 2 churches, one in Hartford, the other was in Bloomfield. And, you know, Mr. Davis, speaking to you, were talking about the frustrations. You know, the appointments are available based on vaccine availability, and we're doing our best to get as many vaccines as we can. And when that happens, we are opening more appointments. And so the biggest piece of advice that everyone is being given as they have to book their appointment through MyChart Plus is to keep looking back often, refresh, and more appointments will eventually open, but just be patient with that. And there is obviously a bit of a backlog because just a week ago, we opened up eligibility to a whole new age group. So we are working on that. And we just spoke of the information and the accessibility, which are really 2 critical parts to making sure that the Black and Hispanic communities can get vaccinated. But one of the other things that is very interesting is some of the hesitancy with the vaccine is also driven by history, which has caused mistrust among the Black community and the medical community at times. And I want to talk about just 2 examples that some people are probably very familiar with and others may not, and we're sort of learning here together. The first one is the name Henrietta Lacks, a Black woman who died in 1951 at the age of 31 from an aggressive form of cervical cancer in Baltimore. Now, doctors had taken samples of her cancerous cells during her treatment and then gave some of that tissue to researchers to study without her consent. Now, it is important to note, though, this was legal at the time, but many point out that it was wrong from a moral perspective. Henrietta's cells, which were the first immortalized human cell line, became pivotal in biological research, referred to as HeLa cells, the first 2 letters of her first and last name. And over the decades, these cells have been used for the development of the polio vaccine, the study of leukemia, AIDS, and cancer all over the world. So certainly good news in that capacity, but there was a tremendous amount of criticism because of all the medical companies that benefited from her cancer cells did not pass any of that money back to her family. And obviously that did not sit well with a lot of people, specifically people in the Black community. There's also the Tuskegee syphilis study. In 1932, hundreds of Black men in Alabama signed up for a study through the U.S. Public Health Service that they thought would test them for health issues. The study was really meant to follow the effects of syphilis. And the men involved in the study were never told that they had the disease, and it was left untreated in order to obtain medical research. even though medication was available at the time to treat it. Now, this study continued until 1972. So if you do the math, it went on for 40 years until these wrongdoings were ultimately exposed. And some of the men who were part of this study did die. So some historical reference there in perspective. And I would like both of you, Dr. Anyimadu and Mr. Davis, to weigh in on this. These are just two examples. These are the stories that stay with people and are causing some hesitancy with the COVID-19 vaccine. Mr. Davis, I want to start with you here. What would your advice be to the people out there who are holding on to these stories? They remember them, their parents or their grandparents telling them about them. What would your advice be if this is what's holding them up from getting the vaccine?
To hold on to your history and always share that history, but look at that history and do the right thing with it. That history is talking about being denied medication so that one could live. Right now, we're talking about giving medication so you can live. It's two different things here. Yes, we got to hold on to our history and remember the dark past, our dark past, yes. But also this is a new day, and we have many of our own people in the field of medicine and in the field of science. And some of these people are the people that's at the table discussing and finding cures and stuff. So we have our people there that we could trust. This is an opportunity for you to save your life. Save your life.
And the lives of others. Dr. Anyimadu, I'd like your perspective on that. What would your advice be to people who are really clinging to that historical perspective here, and it's causing them to decide not to get the vaccine, or they're on the fence about it?
I know. So Henrietta Lacks, Jane Sims, Tuskegee, all of these are atrocities that are unfortunately part of American history, right? They have become something like a non-healing wound in the American flesh. And people who cite these atrocities have a legitimate reason to do that. And like Mr. Davis said that we have to hold on to this history, right? But there's a Harvard historian, Evelyn Hammond, who wrote in the New York Times and said that there has never been any period in the American history where the health of Blacks was equal to that of whites, right? So it is true, we can't deny this fact. But President Clinton said something in 1997 when he apologized to the American people for Tuskegee. And he said that what was done was wrong. What has been done cannot be undone, but we can end the silence, right? And I believe that our leaders and institutions are beginning to end the silence. And they are beginning to be more inclusive, more equitable, but there's a lot more that needs to be done. So what I say to people of color and minority groups is that we have to take some responsibility and take some control of our health at this point. There's a lot that has been done, and we can't deny that fact. But this is a time where we need to get on board and get vaccinated, because it's going to save lives. It's going to save your life, and it's going to save the lives of other people around you, your neighbors, your friends. Sometimes as Mr. Davis was saying, that there are a lot of prominent Black people that are working on this vaccine, right? We know that Kizzy Corbett is an African-American woman who is one of the leading scientists behind the Moderna vaccine. And she is an African-American woman, in fact, a 35-year-old African-American woman who has been leading all these efforts to bring the Moderna vaccine to us and to develop it, right? So there are key people in there that are helping this effort with the vaccine. And I think that we can trust the vaccines. It's true that we have all this history behind us, but this is a time to look forward and end the silence and get the vaccine.
All right, interesting perspective from the two of you there. on the historical reference. I want to move on to the second part now of our interview. So Hartford Healthcare has done a tremendous job really putting a lot of information online on our website. It's hartfordhealthcare.org/vaccines. If you go there, there's a tremendous amount of information and resources that you can educate yourself on everything going on with the vaccines. Also learn how to sign up through MyChart Plus, and there's a lot of resources there that I encourage you to check out if you're on the fence with this. But we want to go through some of the questions now. Some of the talking points that are circulating out there, some of these are myths. Some people are getting misinformation. And so we really want to set that record straight. And so Dr. Anyimadu, we're going to go through this right now. We have a little more than a dozen questions, and I think a lot of these are very critical. So the first one, to explain to people, how do the Moderna and Pfizer vaccines work, and are they safe?
So these vaccines are very safe, right? Well, so far, over 72 million people, or 72 million doses of the vaccine has been given. And we haven't seen any concerning safety signals, right? How do they work? The Moderna and the Pfizer vaccines are just messenger RNA vaccines. So your body is given a genetic instruction to produce proteins that look like the proteins on the actual virus, right? And when you get a vaccine, your body produces that protein, and then your body induces an immune response to that protein. So all that's happening is that your body is getting ready to face the actual virus when you happen to get exposed to it. So it's very simple. That's all that's done. You get that genetic material, your body produces that antibodies that look like the spike protein. And then once you get that, once that spike protein is produced, your body induces an immunity. And that immune response will last and be ready to protect you when the virus actually strikes.
The Johnson & Johnson vaccine, which is now being administered, it began being administered last week. It does work a little differently. Explain what the situation is with Johnson & Johnson.
So the Johnson & Johnson vaccine is similar to a larger extent, just like the Moderna and the Pfizer vaccine. The goal is the same. It's to produce that spike protein, or proteins that look like the spike protein on the virus, right? And then your body will induce the immunity. The only difference is that the Johnson & Johnson vaccine, instead of using a nanolipid particle, they are using an adenovirus. An adenovirus is a virus that causes common cold. So they've inactivated that virus such that it's non-replicating. So that virus cannot replicate. So they are using that virus just as a vector or as a vehicle to get that genetic material to your body. So that once that genetic material gets in your body can induce the immunity and wait just in case you get exposed to the real virus. So it's similar to a larger extent.
The one thing people have probably read is that the Johnson & Johnson efficacy is lower than the other two vaccines, which are between 94 and 95%. So what should the takeaway be for people when they see that lower number with the Johnson & Johnson vaccine?
I know that the vaccine efficacy rate that's going around in the media everywhere has been very concerning for people that are considering the Johnson & Johnson vaccine. But the truth is, these vaccine efficacies cannot be compared. You would be comparing apples to oranges if you try to compare them. The Johnson & Johnson vaccine was done in a setting where the variants that we are seeing right now were circulating. So some part of the study was actually done in South Africa, where the South African variant was the majority of the circulating virus at the time. So getting a vaccine efficacy of 72% in the US, you can't compare that to 93 or to 95% or 94% of the Pfizer or the Moderna vaccine. But the bottom line here is that For the Johnson & Johnson vaccine, it protects you 72% against symptomatic infection, 93% protection from hospitalization, and then 100% protection from death. And it's a one and done vaccine, right? So you just get one dose and you are 100% of the time protected from death. I mean, when we talk about COVID-19, the reason why we are all worried is because of the fact that it can make you very sick to the point where you'll be hospitalized, to the point where you can die from the virus. So if you have a vaccine that will prevent death 100% of the time, I don't think there is any question, there should be any question at all about the vaccines. And all these vaccines will protect you 100% from dying, and then 93% from being hospitalized. I would encourage everyone to get it.
Those are certainly good numbers there when you explain it like that. The other question that a lot of people have, can any of these vaccines alter your DNA?
No, these vaccines do not alter your DNA. I know that's been circulating because the Moderna and Pfizer vaccine are messenger RNA vaccines, but the messenger RNA has no way of getting into your nucleus or getting into the nucleus of the cell, so it cannot alter your DNA.
Can someone get COVID from the vaccine? That's another one that's circulating out there.
No way. So there's no way that you can get COVID-19 from the vaccine. As I explained earlier, the vaccine is just a genetic instruction that's being given to your body. You're not being given the real virus. It's just a genetic material that's put in the vaccine and injected into you. So there is no way the vaccine can give you COVID-19.
These vaccines, we know, were developed very quickly. How were the drug companies able to do that? You know, it was called Operation Warp Speed, and that name, I think, led some to believe that quality may have been sacrificed there, but that is not the case. Explain.
So the primary goal of these vaccines when they were being made was safety and efficacy. Right. It's true that the platform that was used, these vaccines were developed very quickly within a year. But the truth is this platform has been studied or has been tried in multiple other vaccines. And it's been studied since the 1990s. Right, there's a Hungarian professor who is a BioNTech, one of the companies that produced what we commonly call the Pfizer vaccine. She's been working on this on the messenger RNA platform. Her name is Katala. I'm blanking out on her name, but she's been using this platform since the 1990s. So the platform has been there, and it's just that we were able to take advantage of that platform to produce these vaccines very quickly.
Variants, we had mentioned them a little while ago. We are seeing some new variants of the virus. Just explain briefly, you know, why we see these variants. And the big question everyone has, will these vaccines be effective against those variants?
So coronavirus is it's an RNA virus, and RNA viruses replicate and make mistakes all the time. So as they replicate, they make mistakes and mutations happen, and they have variants. And the variants are those that are strong enough, those viruses that are strong enough to resist the pressure that we are putting on them. So like any other living thing, they want to survive. The viruses want to survive, and they want homes to live in, the homes being us, so that they can replicate. But as they replicate, unfortunately, we are seeing viruses that have the capability to transmit more readily, right? And that's why we are seeing these variants. And variants, we will continue to see variants of coronavirus as this pandemic goes on. And that's the more reason why we need to get as many people vaccinated as possible so that we do not give the virus a home to replicate. The good news is the vaccines that are available right now all have some protection against the variants. We know that the South African variant, the protection from the vaccines that we have been reduced a little bit, but you are still protected when you get these vaccines against the current variants that are circulating. So there's no reason at all, at least at this point, to worry about the circulating variants. The vaccines will protect you from the variants.
Certainly good news there for a lot of people. Some people do have side effects after getting their first or second dose of the vaccine. Why does this happen, and what can people expect necessarily when they go to get the vaccine?
So these side effects, as we call them, are adverse reactions, right? And they are expected response to the vaccines. These side effects, including the injection site pain, the headaches, the body aches, the tiredness or the fatigue, are all signs that your immune system is ramping up and producing the right immunity that you need against the virus, right? Unfortunately, sometimes it can really make you feel very down, and it can make you feel sick sometimes, but most of the time, within 1 to 2 days, all these adverse reactions go away. So it's a normal response or a normal or unexpected response of the vaccine. And they are very mild. Some people don't feel anything at all. And even for those who have these reactions, a lot of them within 1 to 2 days get better.
If someone has underlying health issues, can they get the vaccine?
Yes, so if someone has underlying health issues, they can definitely get the vaccine. In the clinical trials, both in the Moderna and the Pfizer clinical trials, they specifically included people who had underlying conditions, including diabetes, hypertension, heart diseases. And about a third of the people in the clinical trials had some form of underlying conditions, and they all did fine. So you can get the vaccine if you have underlying health conditions.
One of the other big questions is the vaccine or any of these vaccines safe for women who are pregnant or nursing? There's a lot of information out there circulating, and some people don't know what to believe, what's true, what's not. So setting the record straight here, is it safe for women who are pregnant or nursing?
So the truth is, for ethical reasons, and it happens with most clinical trials, both Pfizer and Moderna specifically excluded pregnant women and nursing mothers from the vaccine clinical trials. But inadvertently, some of the people that were recruited eventually became pregnant, right? And they are being followed to see what will happen to their pregnancy. But in animal studies that were done even prior to human studies, there were no safety signals or concerns that it could affect the fetus, right? So at this point, if you have a significant risk of acquiring COVID-19 and you're pregnant, it's recommended that you consider getting the vaccine. I'm sure most of us live in places where there's coronavirus is circulating everywhere and the infectivity rate is very high, or the case rates are very high. So if you are at risk, or if you're on the front lines and you are pregnant, it's still recommended that you get the vaccines. And it doesn't matter which one you get, either the Moderna, the Pfizer, the Johnson & Johnson, all of them are appropriate and you can get them. The other good news is that since the vaccine started, the vaccination effort started, as I said, over 72 million doses have been given. And the CDC has this app where you can report adverse reactions. And there are about over 2,000 pregnant women that have chosen to get a vaccine. And we have a lot of data from them. And so far, there haven't been any safety signals. So I think you have to assess your risk. And for most of us, the risk is very high that you can get coronavirus. So you have to assess your risk and consider getting the vaccine. It's highly recommended that pregnant women get the vaccine.
A few more questions here. If someone already had COVID, do they need to get vaccinated still?
They still need to get vaccinated. You know, when you get COVID-19, you do produce some antibodies to the vaccine, to the virus. So you will get some antibodies from getting COVID-19. It's not everyone who produces antibodies. We know that some people who get very mild illnesses do not produce robust immunity. But when you get the vaccine, the immune response that you get against this virus is far higher than what you get with natural infection. So I think it's very important that even when you get COVID-19, you should still consider getting the vaccine. It's recommended, you can choose to wait. CDC doesn't recommend that you wait, but you can choose to wait about 3 months because we know that your natural immunity will last about 3 months, probably more, but you will get a more robust immune response when you get the vaccine.
The other thing too, and we mentioned this at the beginning, the CDC just issued guidance for vaccinated people when it comes to mask wearing and social distancing. It's a pretty big deal. Explain what has changed and how people should really proceed with this information that just came out.
You're right. This is off the press. And so the CDC says that for those who have been fully vaccinated, and by fully vaccinated, they mean that if you got the Moderna or the Pfizer, you've gotten both doses and you've waited 2 weeks after getting your second dose. And for those that are getting the Johnson & Johnson vaccine, you've gotten your first dose and you've waited 2 weeks. So you're fully vaccinated. The CDC now says that you can actually spend time indoors with someone who has also been fully vaccinated. And you can spend time with a family that have also been fully vaccinated. They do, however, caution though, that if you are fully vaccinated and you are visiting a family that is also fully vaccinated, or even a family that is unvaccinated, you should consider whether there's someone in that cohort or in that family who hasn't gotten, who may have a very high risk of dying or having severe infection from COVID-19. So you should consider those things. And if there's someone like that, then you probably want to wear a mask. I'm still getting familiarized with some of the recommendations that they made here. And I have it right here. They said that you can visit with fully vaccinated people indoors without wearing a mask or physical distancing. You can also visit unvaccinated people from a single household who are at low risk of severe COVID-19 disease indoors without wearing a mask or physical distancing. You should, however, refrain from visiting such people if there is someone in there who is at risk of dying or who has a very high risk of dying from COVID-19. And the good news is if you've been fully vaccinated, you can refrain from quarantine and testing following an exposure to an asymptomatic, following an exposure if you are completely asymptomatic. So this is a lot of good news. And I think that this encourages everyone to get vaccinated. So we can do a little more than we did before. if you are fully vaccinated. I think it's very exciting news.
Yeah, certainly good news that a lot of us have been waiting for. Finally, one last question, and we're going to bring Mr. Davis back in. The governor has announced that certain COVID-19 restrictions in our state will start to be loosened, if you will, the end of next week in terms of restaurants, places of worship, museums, gyms, and retail stores. Your advice to people as we try to resume a sense of normalcy, but also really maintain the balance of safety, what would your advice be?
I think it's exciting that we can begin to do some things. We can begin to open up some of the places that have been closed for so long. But I would say that we have to be cautious as we open up, there, especially in the setting of these variants, right? There's still variants that are circulating around, and we know that some of these variants are circulating here in Connecticut. So the first thing that I would say is that people should get vaccinated, get vaccinated, get vaccinated. We can't say that enough. You have to get it when it's your turn. These vaccines are safe and effective. And the best vaccine that you can get is the next available vaccine to you, right? And we have to continue to follow all these public health safety measures and the travel guidance. We have to continue to wear our mask where we have to. If you are in an enclosed area with a lot of people there, or if you're going for gatherings or congregations in churches, you really want to be wearing masks. But the good news is what we heard from the CDC today, that if you're fully vaccinated, you can begin to sort of loosen some of these public health measures.
All right, yeah, good news there. So we have Mr. Davis back with us. We do have some questions coming in on Facebook. Some of them we've mentioned. I want to go to the one from Colleen. She said, can any of the vaccines produce an exaggerated immune response and trigger autoimmune disease down the road? So Dr. Anyimadu, were you able to address that?
So not that we know of. I think we all have to accept the fact that these vaccines have been around for just about a few months, right? So we don't know the long-term immune response, whether there will be any form of autoimmune response to these vaccines. But so far, as I said, in the clinical trials and in the 72 million doses that have been given across the US, we haven't seen any concerning safety signals with regards to autoimmunity, right? So to the best of our knowledge, we don't think that this is going to be a concern.
Maylee asked on Facebook, is it safe for someone taking blood thinners to get the vaccine?
At this point, I don't think there's any contraindication to getting the vaccine if you are on blood thinners. The CDC has strict contraindications to tell people when it's not safe to take a vaccine. And being on blood thinners is not one of them.
And of course, if anyone does have any concerns or questions, they should always be consulting with their doctor.
Exactly.
Rosa asked, when will the Hospital of Central Connecticut have vaccines available? They have been being given out at the hospital, but that is transitioned now to 1 Liberty Square in downtown New Britain. So you can go there. Mr. Davis went there for his vaccine. So that location is up and running. And one other question, Rosa has a follow-up. If someone who is allergic to eggs, peanuts, and fish, can they have the vaccine? And if so, which vaccine would you potentially recommend?
So there is no distinction between the vaccines. All of them are fine to get. So the CDC says that if you have some of these food allergies, there is no contraindication at all to getting the vaccines. You would have to be monitored for about 15 minutes after you've gotten the vaccine at the vaccination centers. So if you have food allergies or even medication allergies, outside of injectables or having an anaphylactic reaction to any injections, you can safely get the vaccine.
Good to know. A lot of great information, a lot of the questions that people are asking, and hopefully we provide that clarity. Mr. Davis, I want to go back to you. We'll give Dr. Anyimadu a little bit of a break here. I kind of want to give you the last word. Everything we've talked about, the importance of this conversation, what would your advice be to the members of the NAACP and really the members of the Black and Hispanic communities out there that are on the fence with this and they're unsure whether or not to get vaccinated? What would your advice be?
My advice at this time is to take heed to the information that you're receiving. Look at who's feeding you information. It's about your life. It's about your family's life. It's about your children's life. If there is something else that could save you, then let's talk about it. But there's nothing else that could save you. So be wise in your selection. To live or not to live, that's what it comes to.
Yeah, well put there. Simple, but very true. Dr. Anyimadu and Mr. Davis, I want to thank you both so much for being part of this conversation and really lending your knowledge and your experience to help pass along information that a lot of people are looking for right now so that they can make the right decision for them. So thank you both for being here. If you have any questions about the vaccine, how to enroll through my charts, where you can go, the eligibility requirements, again, I mentioned it earlier, go to hartfordhealthcare.org/vaccines. We have all of the information there for you. Gentlemen, once again, thank you for being part of this conversation. We really do appreciate it. Of course, thank you for joining us. For Hartford Healthcare, I'm Brian Spyros. Have a great night.